Choosing the right exercises for your diastasis recti exercise progression can be really important. You want to start with something nice and simple like a dead bug, making sure that you're creating that great foundation of abdominal bracing. Then you want to progressively make it harder so that you're challenging those abdominal muscles so that they're having to show up, they're having to work, and that way you'll get remodeling. Now, keep in mind that if the exercise is too hard and you get a lot of really firm doming out of your diastasis, then that may be doing more harm to the tissue than it does remodeling. But a little bit of doming, especially if it's soft, is not a big deal because you've got to really walk that line of progression to be able to keep moving forward, and you want to make it challenging. Crunches can also be a great way as long as you note more flattening and making sure those ribs come in and down and you're not getting a lot of pooching or bulging when you're doing them. I love the crunch with a twist to really get those obliques going and find those abs. Then, if you want to add in a little bit of serratus anterior to help reach through with those crunches, that can really help narrow that rib cage, bring that rib cage in, and really get some great upper ab involvement, which is wonderful if somebody has a more of a middle belly button area diastasis or an upper diastasis. I love working lateral abdominals when it comes to diastasis because then you're getting those transverse abdominals, obliques, you're getting all those lateral abs, which is incredibly helpful for helping to remodel that midline fascia because those lateral abs end up coming into that midline fascia. Making it progressively harder is going to make you stronger. And then as we flip over into hands and knees, then you can do a hands and knees progression. Start with just a simple opposite leg lift, arm lift. You're getting some abs here, working on bracing, working on not giving a big shift. As you lift higher, you're going to want to shift more, so you're going to want to tense your abs to prevent that shift, making sure you're keeping your neck relaxed. And then as you're feeling ready, you can go out into full planks. So full planks will be the most challenging for rectus doming or midline doming, and you can do marching in full planks. You can do opposite arm and leg touches. Seeing some rectus doming in full planks can be really common, especially if you're tucking a lot, so you can be a little mindful of that. So enjoy this full ab diastasis progression and pick the right exercise for where you are in the process, and make sure that you keep pushing that envelope to keep yourself moving forward.